Hello and welcome to another edition of Gombe's Transformative Journey. I am so glad to have you join us today. Our focus is on the transformation occurring in the healthcare sector in Gombe State under the leadership of Governor Yahaya. 114 primary healthcare centers have been renovated and upgraded, ensuring that every resident of Gombe has a primary healthcare center close to them. Another transformation occurring is the arrangement by the government to buy medication in bulk directly from manufacturers, bringing down the cost of this medication and ensuring that only the best medication gets to the people of Gombe State. The crown jewel of these reforms and transformation is the Gombe State Contributory Health Insurance Scheme that covers everyone that subscribes to it at a very affordable rate, ensuring quality care at affordable rate without the concern of out-of-pocket expenditure. These and more are going to be brought to you after this short break. I am Landry Adeyemi.
The great 19th century statesman Ralph Waldo Emerson said, "The first wealth is health." In the right scale of preference, good health is to be desired above fame or riches. Governor Yahaya had his priorities right from the beginning of his administration. For him, providing quality healthcare is more than just a promise. It is a commitment, a solemn pledge backed by will and competence. Immediately after his inauguration on the 29th of May 2019, Governor Yahaya proceeded to the Gombe State Specialist Hospital to personally assess the situation on the ground. Undesirable is a mild way to put it. Some would say that the system had completely collapsed. Dilapidated infrastructure, few unmotivated health workforce, lack of basic equipment, an unstable electricity supply. Patients are often treated on the bare floor with torchlights. The need assessment and poverty survey carried out in 2018 clearly shows the rot in Gombe State's health system. Rather than cursing the darkness, Governor Yahaya turned on the light. A bold statement of intention was declaring a statement of emergency in the health sector. It started with the full transformation of the specialist hospital, Gombe. The old accident and emergency section was demolished. The new structure is an ultra-modern story building boasting of theatres, pharmacy, offices, spacious consulting areas and other amenities.
When this administration came in 2019, the health system was comatose, and immediately from the stadium, when His Excellency was sworn in, he drove straight to the specialist hospital. And that has been his dream. When we were growing up, he noticed the hospital was not progressing the way it should be, and he prioritized health, and that is why he moved in there. At the specialist hospital, he now directed immediately, a task force was formed to transform the hospital to a very high standard in terms of infrastructure, personnel, and equipment.
Accommodation facilities for house officers and resident doctors are a sight to behold. Beyond equipment, the accreditation for residency training at the state hospital proves the tremendous improvement of not just physical infrastructure and manpower, but the overall quality of the hospital. The outbreak of the COVID-19 pandemic sent shockwaves across the world. Like other states, Gombe was hit hard. But committed and skillful leadership helped the state to sail through the storm.
This infectious disease hospital to serve as an isolation center for COVID-19 to the glory of Allah subhanahu wa ta'ala and for service to humanity. While coming as a government, we worked and we campaigned throughout the nooks and crannies of the state so as to identify the needs of the people and prioritize what we need to address if Allah makes it possible for us to be in government. God answered our prayers and we are in government, and I believe we have not disappointed the people. On the health sector alone, you've mentioned it yourselves. And our emphasis with the vision we had was to work towards achieving and improving on human capital development through all indices. And that doesn't come if you don't care of health, because you need to be healthy and lively before you eat, in virtually all that we did. But on the need to provide good quality human resource for our hospitals. That was the reason why we even set up the Health Sector Revitalization Task Force. Both primary and secondary healthcare facilities are being focused on. We are accessing very soon facilities from the central bank to work on the remaining secondary healthcare facilities. And I think with what we did, we cannot cover all, because Gombe has, I think, 628 primary healthcare centers, but it's not in the numbers. Our focus is to have at least one functional primary healthcare center in each of our wards, 114 of them, that can work 24/7. And we are close to achieving that. And with what we did in the specialist hospital, you don't need any more testimony. You can go around and see for yourselves. If we are able to reach out to the remaining general hospitals, we would have covered all that we need as far as structures are concerned. We can pay all the money, but if you don't have functional structures, I think it will be useless. We can have all the training, but you have to find a place in which to practice. And what you see there, it's left for you to judge. So we must work like in tandem, hand in hand, before we get the required results. So I urge you to do more.
The emergency response was robust, with top experts taking the lead, backed up by strong political will. Governor Yahaya coordinated the community engagement and fearlessly led from the front through the raging disease outbreak. Emergency funds were released to boost the health sector and ensure that intensive care could be provided for patients who require it. A brand new molecular laboratory was built and equipped with state-of-the-art equipment.
We also had the COVID laboratory. We were the first to produce a PCR machine. Gombe State government procured during the COVID PCR machine and ensured that tests that were hitherto taken to Irua, taken to Abuja, and the reaction time is long. Now we are able to do the test here, and the lab was now upgraded by WHO and NCDC to a level 3 laboratory, so we could do many other tests now in those places and public health. When we came in 2019, there was state primary healthcare development comatose, so we reject the primary healthcare development agency, bring in new hands, additional professionals in public health that will address issues of primary healthcare. Then we established Gombe State Contributory Health Scheme. There was the formal and the informal and the equity, the poorest of the poor. The whole idea is to achieve universal health coverage, to provide access for everyone to get treated, to get treated in a hospital setting.
Quick but lasting reforms were initiated in the sector. The Primary Healthcare Development Agency was rejigged and repositioned for improved and effective service delivery.
we had a declaration that will manage primary health care under one roof, meaning you provide all facilities and manage it within, one roof within a primary health care center in a ward. So typically, that was what formed the basis on which now we worked, to ensure that by 2022-23 we are able to have this 114. And besides those, we now have to ensure that along the healthcare subsystem, the ecosystem, you have every part of the chain. It's like a chain. If you have the commodities without the personnel, nobody will do the prescription and ensure that it is applied well. You have the facilities without the personnel as well, or the facilities are not well functioning without proper lighting, without water, there will be no sanitation. You go back to the same place.
The Gombe State Contributory Health Insurance Scheme was introduced to eliminate the burden of out-of-pocket medical expenses. The Gombe State Drug Management Agency is a game changer that ensures quality medication at the lowest cost and a smooth and efficient supply chain, guaranteeing that even the smallest care center has a properly stocked pharmacy. The establishment of a hospital management board has also made visible impacts by improving motivation, administrative effectiveness, and better deployment of resources and supervision. The backbone of public health is primary health care centers. Governor Yahaya took the bull by the horns to renovate all the 114 PHCs in Gombe State. Many were fitted with solar-powered inverter systems to ensure round-the-clock electricity supply. They were also provided with adequate water supply and other amenities.
Before in our health facility, we have problem of infrastructure, problem of water, and then even the light. We don't have solar. We don't have 24 hours light in our facility. Even issue of the manpower. We have problem of the manpower. But for now, I think we don't have this problem. There are many improvements in our health facility. Before we used to buy water from these Tangarua people, but now we have borehole in our facility. We have water for 24 hours in our health facility. So even in terms of manpower, before we don't have enough manpower. Most of our staff attendant or another courses, but now we have enough manpower, and then we used to conduct 24 hours services in our health facilities. Even the issue of light, we have solar, and then we have generators, so we have 24 hours light in our health facility.
We really appreciate what the governor is doing for the primary health care. He's really trying. We have enough of drugs. We are having all the facilities, equipment. As before, we used to use torchlights or our phone in order to attend the women that are ready to deliver. But as of now, we don't even use all that torchlight, phone. We have the solar. Solar usually, it helps us seriously. We are enjoying it. Even the patients, even the women that came for delivery, they are so happy for the light that we have as of now.
Da asibitinmu, especially na muna da karancin ma'aikata, sannan muna da karancin wayanda sukan zo a jinya. Sai dai yanzu da wannan program ya zo na Go Health, mun samu ma'aikata wadatacce ko mun samu magani wadatacce, daɗin akwai dotti, daɗin kuma ba yawan kujeru, daɗin kuma muna da karancin ma'aikata. Ko ma'aikatanmu suna da gandan zuwa, saboda wani lokaci in an zo muka ini a nan ba mu samu patient ko ɗaya ba, amma yanzu kan dare da rana muna samun marasa lafiya kuma ana musu jinya.
From Barrow, Nasarawa in the north to Filia in the south, The transformation of the primary healthcare sector is obvious and making tangible impacts at the grassroots. Testimonies of lives saved, better service rendered, and improved work environment.
Basically, that of the electricity, and it's very, very welcome. We are very happy about it. The chairman, local government chairman, just left now. I just went to have a handshake with him. We visited him the other time. I was not part of it. In fact, our electricity is bam now. We have close to 20 hours of electricity.
This cottage hospital, Malan City, is very, very important to the community of Malan City because this is the referral center for them. All the other primary healthcare centers that is within the local government, primary local government, especially this Malan City, they referred all their cases here because this is a referral center. And we thank God, most of the referrals, they get well and they go back home.
There is a lot of changes because in cervical screening, we are doing it free, no any token to be paid. ANC, we have free drugs from Irene. Commodities of family planning, it also been distributed to us free charge. Really, it has infected is the women they are alert because we have been seeing changes. They have been coming to hospital on, and also they are even thanking the government for the free services that are rendering to them.
The health care system here for the past 6 years to date, there are differences. But now, the health activities have changed. Many people are assessing us. Likewise, before, we don't have many enough clients that are grouping here. But now, as the hospital has been upgraded to cottage, and we have more staffs now. Before we did not have any midwife here. We did not have medical doctor, nurses, but now we have availability of them. Even my unit, before the labor room was not like that. They have renovated the labor room. It was interesting. Even the women, when a woman delivers here, and she go back home, she tells others, they are even eager to come and deliver here because of the changes. On the side of the drugs, there are availability of drugs.
Don tun lokacin da ina ga lokacin da tana zuwa awo wanda ba karkashin gwamnati ba, kowane zuwa awo da zaka biya kuɗi, amma wannan kyauta ne. Har ya zo ga lokacin haifuwanta. Gaskiya lokacin haifuwan ma an yi kokari, inda a ce a yanzu ka biya kuɗi ne zai fi, za a caje ka almost zai kai 15,000, in ma bai fi ba ma kenan, amma duka komai an yi shi kyauta. Gaskiya akwai kulawa ko kuma taimako sosai.
Kamar shekarun baya da ya wuce, asibitin nan zaka je wani wuri ma ka samu duhu, amma yanzu ko ta ina ka shiga, duk ko ta ina haske ya garwaye. Da duk kwaruruka cikin asibiti, amma yanzu ko ta ina ka bi kana taka titi ne. Gadajen asibiti an gyara su, komi da komi dai na cikin asibitin nan yanzu kan sai godiyan Allah. Gaskiya an yi mana gine-gine a cikin asibitin nan. Kamar shekarun baya da suka wuce, wata ran zaka zo ma gashi dai rashin lafiya ya shige ka ba wurin kwanciya, amma yanzu kana zuwa ga wurin kwanciya available, komi da komi. Ba abin da za mu ce ma shi Muhammadu Inuwa Yahaya mai girma gwamna sai godiya. Allah ya taimake shi, Allah ya kara mishi buɗi.
An elderly retiree shares the importance of the PHC in his community and the life-changing services rendered day and night.
I myself am a retiree. I have nothing. If I'm sick, no, the Go Health will assist me because I don't pay any kobo. That is the essence of the government, to help the weak people, especially we that have retired. And Also all women, all men who are farmers, but they don't have any access to get medication. So they have really done a lot. For myself, especially, I started this, getting the benefit of this Go Health since 2023 up to date, and I'm benefiting it because life here in the village sometimes is so scarce. You don't have things, money to pay medication and that's drugs. So, but with this program, the government has done a lot. They have assisted many people who are not privileged to get something.
Wannan kati na gohil na karɓe shi shekaru kusan 2 da aka fara ko 3, kuma ina amfana da shi, kuma dukkan mutane a nan muna amfana da yawa. Ni na samu lalurin ciwon hawan jini da su zazzabi da sauransu da kuma kullum na zo ana bani. In na zo ba a samu a nan ba za a tura ni general in je ni a bani. To don haka ni gaskiya ina godiya da gwamnanmu na Gombe State. Allah ya saka masa, Allah ya bashi abin da yake nema duniya da lahira, Allah ya ɗaukaka shi. Mun ji daɗin wannan abu da ya mana. Yaranmu da manyanmu muna cin gajiyan wannan al'amari. Allah ya ba mu sa'a. Mun gode, mun gode.
The influx of patients seeking care at most primary health centers in Gombe State has more than doubled, partly due to increased manpower, better facilities, and the health insurance that reduces the burden of out-of-pocket expenditure.
The data is there, and it's a national data. So that data alone speaks for the investment that the present administration has done in the health sector. The NDHS 2018 statistics revealed a skilled birth attendance of less than 20% in Gombe. The NDHS of 2023 revealed a skilled birth attendance that is nearly 40%. That's in about 5 years gap. And these are national statistics, not local statistics. The percentage of fully immunized child from 2018 to 2023 has more than doubled in Gombe. The infant mortality rate has dropped by about a quarter from 2018 to 2023. And I think this is a clear testimony that the health outcome of the people of Gombe is improving for the better from 2018 to where we are today. And with the kind of continuous and sustainable investment that is going into the system, it can only get better.
The work is not done. A fresh sum of 3 billion naira has now been earmarked for upgrading selected primary healthcare centers.
The last time the facilities were renovated was around 2021, and now the state governor has given approval of about 3 billion naira for upgrade of about 82 facilities to be provided with solar power, boreholes and equipment to provide 24-hour service delivery. And then through the World Bank partnership also, we have selected about 114 for upgrade and renovation. So I think the next 6 months we will have completed our renovations, and then those facilities, I'm sure, I'm very confident they will experience an improvement in demand for healthcare services. The state governor established a contributory agency in order to kind of bring succor to the poor and vulnerable, protect them from catastrophic health expenditure, provide financial protection for them. And through the Go Health, we have enrolled more than 100,000 poor and vulnerable onto the scheme. They go to the facility, access free services in the facility without paying anything. So that has really improved demand. From our supply side, we also do conduct outreaches in very difficult, hard to reach communities. We go door to door to provide free drugs for pregnant women, provide immunization services, child spacing services.
The reinvigorated primary health system is indeed rock solid and serves as a stable foundation for health interventions and programs such as distribution of treated mosquito nets, immunization, medical outreaches, and antenatal care. Like the transformation from larva to pupa, then later to a beautiful butterfly, the health sector in Gombe is evolving into a modern, holistic and effective public service. A rising sun that will not set, a shining, bright example worthy of emulation. Join us for the concluding part of Governor Yahaya's transformation of Gombe State's health sector.